Hi everyone, welcome to Micro Mahasutra. We are discussing gastrointestinal tract infections and this is our fifth class where we are going to discuss about two important bacteria, Shigella and Yersinia. Okay. So my dear friends, Shigella also belongs to family Enterobacteriaceae. So if you have not seen our previous class, I will definitely recommend you please go and check out for the previous class, because all the features of Enterobacteriaceae you can write in Salmonella, you can write in Shigella, and you can definitely write in E. coli also. Okay. So Shigella, just now I discussed in the last class, Shigella coming I wanted her to be my life partner. She said no, no and no. So she is full of no, no and no. Means non-motile, non-lactose fermenter. But remember, even if she is not my girlfriend, she troubles me a lot. She is a human pathogen. She is highly pathogenic. That means even a minor 10 to 100 bacteria, minor 10 to 100 minutes of talking with her are highly pathogenic. Honestly. So you got it. Non-motile, non-lactose fermenter, very high pathogenicity, and it is a good human pathogen. What are the different species? Remember, Shigella has different species such as Shigella dysentery, Shigella flexionary, Shigella boydii, Shigella soni. So how to remember? Shigella dysentery. Okay, Shigella dysentery. So dysentery, please remember that Shigella dysentery, D for dysentery, she does not ferment alcohol. Shigella dysentery does not ferment mannitol. Okay. Now flexionary. So flexionary flexes. In Hindi we say, itna flex kyun kar raha hai bhai? Why are you flexing so much? Shigella flexionary flexes because Shigella flexionary is the most common species in India. That's why she flexes a lot. But Shigella boydii is less common. Why? Because only less people are bodybuilders. Rest all of them, like 𝗵𝗵𝗵𝗵 and me, we love eating. We are not bodybuilders, okay? So Shigella boydii is less common. Okay? So less bodybuilders are there. So boydii are less. And Shigella soni, in Hindi, Sona is there, and in English, Sona is called as gold. Okay, and gold, you know, is most common in entire world. Everybody loves gold, right? So most common in world is Shigella soni. What is the virulence factor? Shigella toxin. Remember, Shigella toxin acts on the 28S ribosomal RNA of 60S ribosome. How to remember? 60. So S for 60, S for Shigella. So it is going to act on the 60S ribosomal RNA and inhibits the protein synthesis. It inhibits what? It inhibits the protein synthesis. Okay. Coming on to clinical features, Shigella is responsible for causing Hemolytic Uremic Syndrome, whose triad has a mnemonic ATM. A is acute renal failure, T is thrombocytopenia, M is microangiopathic hemolytic anemia. This is not Anjali Tarak Mehta. This is kidney damage, acute renal failure. Thrombocytopenia, the platelets also look like this. Platelets are going to decrease, and there is hemolysis also, microangiopathic hemolytic anemia. Okay. And in the yesterday's class, I told wherever she'll come, she will make your life bleed like anything. So one is hemolytic, one is hemorrhagic. Okay. So hemorrhagic colitis, bloody diarrhea, but very important is reactive arthritis, my dear friends, which is HLA-B27. This is really very important. Reactive arthritis is really important. Okay. So reactive arthritis caused by Shigella, you have to remember, this is important. And if you remember alphabets, P, Q, R, S, S for Shigella and R for reactive arthritis. So, reactive arthritis has got some erythema. I have given the picture. Yes, can you see this picture? Yes, okay. I'll change the color. Can you see this picture? Yeah. So, these are because of reactive arthritis. On the shin, you have got the erythema. Okay. So, shin erythema is there. It is because of reactive arthritis. All right. So, what is the laboratory diagnosis? Remember, DCA, Wilson-Blair media and Salmon Shigella. These are very similar to what we have discussed in Salmonella already. Okay. All the other things are from the Enterobacteriaceae only, right? So, you can copy paste from the last video. Okay. So, last video is must watch. Okay. You should watch that, because that's going to help you in remembering all the things common for Enterobacteriaceae and their fellow members. Okay. Tests are ELISA and PCR, which you have to do. The treatment, mostly we give the cephalosporins, and in that too ceftriaxone we are going to give. Okay, give the cephalosporins. Coming on to the next organism of our discussion, this is a safety pin like organism which is called as Yersinia pestis, you can say, but then Yersinia is a safety pin organism. So, P for pestis, P for responsible for causing plague, and P for safety pin organism. Okay. So, safety pin appearance, can you, okay, I'll show you this safety pin appearance. See here, see this. Can you see 1 second and connecting? Okay, 1 second and connecting. So, this is a safety pin appearance which is going to be there. Okay. Now, very important thing, please remember that you will use Wesen stain. To stain this, you will use Wesen stain. So, Yersinia pestis, okay, remember with my name, 𝗵𝗺𝗺 sir says what? Where there is a way, there is a will. So, P for pestis. What is R? R for rat flea. So, P for pestis also, P for plague also, P for pin appearance also. R is the rat flea. That means the rat is the reservoir and the rat flea, 𝗖𝗵𝗵𝗺𝗺, is the vector for transmission into humans. And where there is a way means Wesen stain is something which you use. Now, there are 3 types of plague which it causes. One plague is called as bubonic plague. Now, what do you mean by bubo? Bubo means when your lymph nodes are going to get swelled up, it is called as buboes. But this is a milder form. The pneumonic plague is a severe form and septicemic plague is the fatal form. So, the severity is going to increase. So, you can remember with the help of alphabets, alphabetical order. Firstly, B comes, P comes and then S comes. So, revising with you again, bubonic plague is having the lymph node swelling, pneumonic plague is severe and septicemic is the fatal one. So, laboratory diagnosis I have told you, Wesen stain is there and it is going to show the bipolar staining. Okay. Please remember, where there is a will, there is a way. So, where there will be a will, where you will do hard work, and hard work is just like hammering the copper. Okay. So, hammering the copper requires a lot of hard work, no? So, hammering the copper is just like putting in a lot of hard work. Okay. So, please understand, on blood agar it shows hammered copper colonies. Okay, you got it. And hammering the copper, C for copper, the other one is the Castaneda's media, the other one is the Carey-Blair media, and in the end ELISA and PCR. So, what will you give for the treatment of Yersinia pestis? You will give either the doxycycline or the streptomycin. Okay. So, either you do the hard work, but if you don't do the hard work, you are going to be sad, my dear. So, streptococcus and D for doxy. Streptococcus and doxy. Okay. So, revising this story with you. So, P and R, R for rat flea, P for pestis, plague, safety pin appearance, will means Wilson stain, sorry, way means Wesen stain, How you should make your will stronger? By doing hard work, just like hammering the copper. So blood agar is going to show you hammered copper appearance. Then you have got from C, Castaneda's media, Carrie-Blair media, that's a transport media. If you don't do it, you will become sad. That means for the treatment, give strepto and toxi. So there are two more others Yersinia species, Yersinia enterocolitica and Yersinia pseudotuberculosis. So Yersinia enterocolitica means it is going to go to your gut. So it causes a pain just like appendicitis, but it is not actually appendicitis. So it is called as pseudoappendicitis, and the drug is going to be doxycycline. Why? Because D and E go together. D for doxy, E for enterocolitica. And why you call it as pseudotuberculosis? Because the most common presentation of TB is involving the lymph nodes. Similarly, Yersinia pseudotuberculotica is also responsible for lymphadenitis. That's also mesenteric lymphadenitis. So this is the thing you have to remember. Okay, these both pictures I have already shown to you. This marks the end of this lecture. Thank you so much for joining. I'll see you in the next lecture. Thank you so much.